latest research on long COVID provides a better understanding for how the condition is likely impacting Canadians and the healthcare system. A recent study published Monday in the Canadian Medical Association Journal has found that long COVID significantly increased doctor visits, home care needs, and hospitalizations for a small number of Ontarians infected early in the pandemic. A similar study by Statistics Canada, also published Monday, indicates the impact of COVID infections varies for those contracting it. StatsCan says this research, in partnership with the Public Health Agency of Canada, is the first national representative report of its kind. Well, joining us now to help unpack this research is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back.
Thank you. Great to be here.
So let's start with the StatsCan study, Dr. Raut. What really stood out to you in terms of information we didn't know about long COVID before?
Right. So there was a lot that stood out actually because it's such a large national representative report. Basically, even looking previous to long COVID, we saw from the rates there almost one third, so 32% of Canadians aged 18 and over tested positive for COVID-19, and then another additional 8.3% suspected they had COVID-19. When we looked at Canadian adults who tested positive or suspected they had COVID-19, 4 in 5 reported having mild to moderate symptoms in their first infection. And then coming to the long COVID piece, what we saw were 1.4 million Canadian adults indicated they had symptoms for at least 3 months after a positive COVID-19 test or even a suspected infection.
That's quite prominent, Dr. Raut. Now, in terms of diagnosing long COVID, can you tell us a little bit more about the symptoms that relate to the condition?
Right. So long COVID is really diagnosed based on a cluster of symptoms. Many organizations like the WHO or PHAC have different definitions for it, but they do agree on a general cluster. Here's what we really know is that we're looking at fatigue, memory deficits, shortness of breath, sleep problems, and joint pain, which is the most commonly found. For Canadians, what we found were 72% who had long COVID had fatigue. The cough was about 40%, shortness of breath another 35%, and brain fog another 33%.
And what do we learn in terms of the Omicron variant and the likeliness of long-term or long COVID developing from it?
So what we know is a very high percentage of Canadian adults with severe symptoms at the time of their COVID-19 infection experience symptoms at least 3 months later, aka long COVID. What we do know is in December 2021, we had this Omicron strain, which became dominant in Canada. This strain was described as less virulent, but much more contagious. Because of that less virulence, we saw is that a smaller percentage of Canadian adults said that they developed symptoms of long COVID compared to the previous strains there. So there was some benefit for sure with Omicron decreasing that long COVID strain.
All right, Dr. Raut. Now, switching gears to the study by CMAJ. Now, that had more of a provincial perspective, but it did give us a look at long COVID's impact on the medical system. So, what stood out to you from this study?
Well, in this study, the authors were really trying to look at the post-COVID burden of health, especially with healthcare use in COVID or community-dwelling adults in Ontario specifically. So they compared positive versus negative tests of Ontarians, and they found a significant higher healthcare usage for people with positive COVID tests. When we say significant higher, we're talking about a large increase to home care encounters, more days in the hospital, and more days in long-term care settings in general. So what we do find is that there's a significant change with COVID versus non-COVID.
All right, and today, Dr. Teresa Tam expressed fears about an uptick in infections during the fall. So, is Canada's medical system ready for the upcoming fall season, Dr. Raut?
Right. So here's what we know worldwide. With the first pandemic wave, as many as 27% of people were admitted to hospital, either died or were readmitted in the first 60 days. And as many as 70% of people were not admitted to hospital, but had at least one symptom 4 months after the infection. So even if we look at the WHO definition, which is 10 to 20% of those infected will develop this post-COVID or long COVID condition, I think we've got to be very careful and we have to have a much more clearer understanding on how to use our healthcare resources to help these patients as they continue to develop these symptoms.
Always an informative interview. Dr. Raut, thank you again for joining us today on Forum Daily.
Thanks so much for having me.